Modified physiological respiration. Here, the modified physiological respiration is laughing, sneezing, coughing, hyperpnea, all are the physiological modifications of respirations. Hyperpnea. Hyperapnea is an increase in rate or both in breathing results in increase in respiratory ventilation. This is called hyperapnea. When stress is over, the hyperapnea slowly comes to the normal. It is generally produced by the voluntary excretion and brain excitement and dyspnea and such other factors like coughing, sneezing, high cough, sogging, yawning, sobbing, crying, laughing. These are the factors which are affect the hyperapnea. The abnormal types of respiration is periodic breathing. In the periodic breathing, here rapid and deep breathing is followed by a period of no breathing. This alternate the cycle keeps on repeating. It means here a rapid and deep breathing is followed by a period of no breathing. This alternate cycle keeps on repeating. There is an ascending rate due to increased accumulation of carbon dioxide which becomes slower and slower then stops for a little while. With deep and fast breathing, the carbon dioxide gets quickly washed out and lungs do not get their stimulus. Breathing stops because of the less alveolar carbon dioxide in the lungs. This is cessation of breathing which is known as apnea. It gives rise to the carbon dioxide accumulation in the lungs which stimulate the breathing again. Stroke or periodic breathing is often seen in children during sleep. It causes asthma conditions. We can see it clearly. It is found in uremia and raised intracranial pressure and opium poisoning. When a person caused by the opium poisoning, this type of breathing will be seen. It is a serious condition and which leads to the death. Dyspnea. Dyspnea is difficult breathing. It is also a type of abnormality of respiratory system. By the lack of oxygen and or excess of carbon dioxide, it will be causes, and it impels difficulty breathing, and it is not trained with the hyperapnea, then also become dyspneic. It is produced by the lack of oxygen and excess of carbon dioxide. Acidosis is also a symptom of dyspnea, and low blood pressure and emotional excitement, these are the symptoms of the dyspnea. Dyspnea is also found in many diseases, namely asthma, pneumonia, heart diseases, anemia, acidosis, and muscular exercises. Asphaxia. Asphaxia, another abnormality is asphaxia. In this asphaxia, few minutes of continuous improper aeration will be occurred, and it is very dangerous. It also leads to the death also. And in asphaxia can be general or local. Asphaxia results from the obstruction of trachea. It results from the combined ill effect of carbon dioxide and excess of carbon dioxide and lack of oxygen, which leads to the asphaxia also. All the stages combine due to and the asphaxia can be general or local. The asphaxia results from the obstruction of trachea and which prevents the expansion of the lungs, and it results from the excess of carbon dioxide and a lack of oxygen which continues depends on the asphaxia. That is, suffocation will be occurred. By this asphaxia, the suffocation will be occurred. In the first stage, it shows excitement, that is convulsions and salivation, resulting in increased respiratory reflexes. The final stage shows slow and deep respiration, and it also caused the death. Another abnormality of respiration is anoxia. In this condition, lack of oxygen will be available in body and increased carbon dioxide, that is the main reason. And also this is anoxia is classified into 4 types, that is anoxic anoxia, stagnant anoxia, anemic anoxia, and last one is histotoxic anoxia. These are the 4 types of anoxia. It is a condition which shows lack of oxygen which available to the body in general. New nomenclature is hypoxia. This is also called as hypoxia. It means diminished supply of oxygen. Anoxia is lack of oxygen in blood is called as anoxia. Absence of oxygen in blood is called as anoxia. There are 4 types, we already know that. And then cyanosis. It is a condition in which skin and mucous membrane will be bluish in color, that is formed in nostrils. It is seen earlier in the tip of the nose or lips, nails and earlobes. It depends upon the increase of reduced hemoglobin in circulated blood. This results from respiratory obstruction, lung diseases, heart failure and carbon dioxide poisoning. Congenital heart diseases will be occurred. One can overcome it by the removing of the mucus from the nostrils by the surgery and operations. And another abnormality of the respiration is apnea. In this apnea, it is a cessation of respiration. In temporary apnea, we can notice the periodic breathing. After hyperapnea, adrenaline injection, sudden rise of blood pressure and during vagal stimulation resulting in vagal apnea. It lasts for more than few minutes and it terminates in death. It is a very dangerous abnormality of respiration. So these are all about the abnormal types of respiration. What is this? Periodic breathing, and second one is dyspnea, third one is asphaxia, and fourth one is anoxia, fifth one is cyanosis, and sixth one is apnea. These are about the abnormal types of respiration. And here comes to the other respiratory disorders. These are all disorders. What are the disorders of respiratory system? They are pharyngitis, laryngitis, pneumonia, asthma, chronic obstructive pulmonary disorder, bronchitis, and emphysema, pleurity, tuberculosis of lung. These are the other respiratory disorders. Previously we discussed about the abnormality of respiratory system. These pharyngitis, laryngitis, pneumonia, asthma, bronchitis, these are the disorders of the lungs.